End of Life Debate Pro Stance presented by Jordan Lee, Kayla Spates, and Natalie Thorson. The key to providing end-of-life decision involves more than just the physician. Article written by Ray Farberman brings up that there are many points in which the important critical role that must be fulfilled when end-of-life decisions are being made. She points out the need for the mental health professional and includes the process of when the patient is wanting to choose physician-assisted death. She goes on to point out that there are many factors that this calls for more than just research to guide in policy and legislation. She states that the role of the mental health professional is to attempt to ensure that the end-of-life decision-making process includes a complete assessment of the patient's ability to make rational judgment and B, to help protect the patient's right to self-determination. The mental health professional attempts to bring the pertinent issues to the patient and his or family and significant others, and to assist the patient and significant others in understanding and working through those issues. The healthcare team needs to actually compromise of not just the physician and the patient and the family. It needs to be made up with a mental health professional because they are able to determine if this is more than just depression, this is actual realization that they have less than 6 months to live. But also gives them that right to their own self-determination of in their end-of-life care. She goes in to point out that the importance of having a psychiatrist involved from the start of the diagnosis of terminal illness is absolutely crucial. With all parties involved, physician, loved ones, and the patient, it's important for them to both be equally involved and informed. She goes on to point out that the very aspect and value of the psychiatrist's role in the end-of-life decision needs to be included upon the further research that they've done with the intensity of this choice. She points out that the cohesiveness of the multiple healthcare professionals could help end up shaping and guiding the policy and legislation for these pro-physician-assisted suicides. In the article, Clinical Considerations in Physician-Assisted Death for Probable Alzheimer's Disease, Decision-Making Capacity, and etc., the researchers addressed that the difficulty for Alzheimer's patients wishes in a physician-assisted death early on in diagnosis is due to the fact that the mental standards that need to be cleared to approve this request. They outlined that the need for the physician to be aware of legislation, the ethical aspects, and the clinical aspects in this area, especially because they want to be able to provide this patient's end-of-life care, but they need to be able to be evaluated for consistent capacity, and that it's critical for them to assist them with the physician-assisted death. It is needed that the healthcare team can ensure that this patient has the rational understanding of what they are seeking in physician-assisted death, and that is because of the fact that they need to be able to be within ethical and legislative grounds to grant this. However, this is something that they want to try to make sure that they're able to do because they're acknowledging the patient's self-determination and choice in how they want to go. When you think about Alzheimer's, and especially if you've seen or had a family member or friend that suffered from Alzheimer's and dementia, by the end of their life, they really don't have much cognitive ability. And it's a very hard way to watch one of your loved ones pass away from. And so by evaluating their consent capacity, they're trying to determine that the physician-assisted death is consistent, it's voluntary, it's well-informed, it's free. They have not wavered 1 ounce from it the whole time that they have stated that they have wanted this. And the big thing is that because of that, if they want to make sure that they can rule out depression, or let's say a caregiver's wish to early end this patient's life. And the big thing about this is that evaluation of consent capacity is able to provide uh, clarity in the patient's wishes. And if the physician can't do it, differential diagnosis cannot be made by that attending physician. Assessment by an independent psychiatrist may help confirm that the request is a voluntary and carefully considered, and it's also necessary to determine whether the patient is suffering from depression from their terminal illness or is capable of informed consent. Now, in the aspect of adolescents and young adults, this document that I came across and it's called Voicing My Choices, and it is not actually in a total effect yet because of the needing to do more research on it. But this document gives that lead that gives that power over to the young adults and adolescents in the say of their end of life care. And it provides a blueprint that allows these young adolescents and young adults the ability to voice their final wishes with their loved ones and with their healthcare team. It also allows them to have decision um, in their care, and it gives that documentation of what they actually want to happen in their final days. But this manuscript could give potentially these adolescents and young adults that legal stance in their care, and potentially allow them to choose that physician assisted death and give them that right to autonomy and self determination. Um, this document actually highlighted a very real aspect because of the patients being young in their younger years. Due to their age, that very one limiting factor could potentially inhibit them from being able to actually have their final wishes executed due to guardians or parents trumping them just because of their age. Unfortunately, I am a parent myself, and that can allow us to voice over what our children's actual wishes are. And voicing my choices is designed to be a place for adolescents and young adults to say what they feel, write what decisions they want that bring them peace and closure, but also it allows them to choose what comforts they want and voice their thoughts and needs. And if anything, it could potentially be that blueprint and legacy document that reaffirms the child's self worth and fulfills their final wishes, in such as saying physician assisted death, due to the fact that there aren't any other more options for them, and they don't want to be in pain anymore. A lot of the procedures, especially when you think of cancer, and you think of any terminal illness, a lot of it ends up with them actually suffering more than comfort measures. And it's honestly not for them at that point for their life to be prolonged into that state. It's more for their loved ones around them. And this document can give them that chance to say, no, I want to go out on my terms. And I know I'm, a young adult, child, but I've made peace with where I'm at, and I want to say when. In another article that I had researched, it was investigating the patient's attitudes towards physician assisted deaths with their terminal illness. And patients want the right to choose. They want the ability to say when, they want the ability to say how, and they don't want to, most of them from this article, do not want to be dying in a hospital or in hospice with people surrounding them, waiting for them to take that last breath. They want to be able to go out on their own terms. And this article provided like an unbiased approach to the delivery of their study, but also they outlined that their limitations were based on patients already involved in palliative care. So death was already forefront at that point because they were already in palliative care. But what they had talked about was the medical ethics that are very, very prevalent in healthcare delivery, and it's autonomy, benevolence, and non-maleficence. And these are about the patient's, the patient's rights, and it's about physicians doing no harm, and it's physicians um, doing good. And is it really doing good and doing no harm to extend a person's life by continually doing hurtful, painful procedures, dragging out their terminal illness just due to the fact that their body has not physically shut down yet, but it is in the process? And they really talk about, most of the patients talk about how they feel that doctors, oncologists, and internists should be able to provide that physician assisted death, especially in those circumstances, because of the fact that that is the backbone of the healthcare community, is making sure that they uphold those three things. But when it comes to terminal illness, those three things are not taken in consideration at all due to the fact that their body is just not shutting down fast enough, and it's keeping them alive longer but in pain. And just think about that. If you were diagnosed with a life-limiting illness, wouldn't you want to say when and how and where? Would you really want your children, your family, to watch you suffer day in and day out in pain and holding their breath, waiting for you to take your last breath? Would you want that